welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachoa with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. Today's session is how to adjust your posture. A little bit about me. I've been in the physical therapy field for over 20 years. I specialize in orthopedics. I'm a board certified orthopedic clinical specialist and a Titleist Performance Institute golf medical professional. So without further ado, let me pull up my slides here and let's talk about how to adjust your posture. All right. So just a little disclaimer. I say this, if you've been to any of my other Better Spaces sessions, I always say this, that the stuff that we're going to talk about is going to be valuable and helpful, but is aimed at a general population. So if you're dealing with something specific, I urge you to get a physical exam from a medical professional so that you can have your individual issues addressed and so that you can achieve your goals without any soreness, aches, or pain. So this is not physical therapy. It's not formal medical advice. It's just a general discussion that we're going to talk about on how to fix your posture, adjust your posture. So the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, pain or injury is a result. So I always keep this in mind, that if you come to any of my talks and you remember one thing, remember this, okay? This pattern of alternating stability and mobility. It looks like this. I've got this video. Hopefully this starts up. There it is. It's loading, but it's basically starting from the foot, ankle, knee, hip. We're looking at this pattern of stability and mobility. Each segment of the body has a specific role. If that role is broken, like say, for example, this foot, or let's say we're going to be looking at the neck and the mid-back. The mid-back, the thoracic spine needs to be mobile. If that's not mobile, then we're going to run into some issues, all right? The neck is supposed to be a mobile segment. Now the neck is sort of like a, it's very, it has 7 different vertebrae in here. What happens is that we divide it, because the bones are so small, divide it in upper and lower cervical. So if we look at lower cervical, the lower cervical needs to be stable and the upper cervical needs to be mobile. So if we extend that alternating stability and mobility pattern from the thoracic spine on up, the thoracic spine needs to be mobile, the lower cervical needs to be stable, upper cervical needs to be mobile. And if we take from below, we look at the lumbar spine needs to be stable because the thoracic spine needs to be mobile. So that's how we go up and down the spine. That alternating pattern, the rules still apply, all right? Now, the one thing that I always tell people is that there is no such thing as perfect posture. If you are saying, oh, I need to sit in this perfect posture, I need to stand in this perfect posture. Our bodies were not designed to stay in any one position for a prolonged amount of time. I always tell my clients that if you're sitting for work, you should take a break at least every 30 minutes, because you should be moving at least every 30 minutes. That's the limit for sitting. And if you're standing, that turns into the limit for standing is an hour. So 30 minutes for an hour, 30 minutes for sitting, sorry, and an hour for standing. Those are the limits. We want to be able to move in and out of those positions. So if you're sitting very rigid and think, oh, I've got like perfect posture and I'm going to be sitting here, we don't want that. We want to be able to kind of move. Our tissues adapt to the positions and postures that you place them in over time. So over the years, if you've been down and looking like this, or everything's down and in front of you, and you're hunched over, your bones, your joints, your ligaments, your tendons will adapt to this position. And it's going to take time to adjust that, to get out of that position. Things that we're going to do today may feel a little weird to you, but they should not hurt. So what we're going to look at is, how do we get into a straight position? What does a good posture look like? And how do we maintain that? So we're going to go into our posture check. So if you're sitting down, we need everybody to stand up. I'm going to grab my stuff here, and we're going to change into my camera angle to here. So turn this over so you can also see this angle. We're going to need a wall. So you're going to stand up and you're going to get up against the wall. Now, you're going to stand up. You're going to get your hips, shoulders, and head up against the wall. Okay. Now, your feet don't have to be against the wall, right? So you can kind of lean against here. Your knees are going to be bent. You've got your hips, shoulders, and head. All right. And we say, all right, what does that feel like? Does that feel comfortable, weird? Are you unable to get your head to the wall? If you're unable to get your head to the wall, then you could take a little towel, all right? And then you can kind of roll it up, and then place that behind your head, okay, when you're here. Because oftentimes when I have people do this posture check against the wall or any vertical surface, this is our reference points. Hips, shoulders, and head should be able to touch that. If we can't get the head here, I'm going to place this towel roll just at the back of my head so I can maintain contact, all right? And then the other check is, if I am up against the wall, is my head level? Or am I up against the wall like this and looking up, all right? That is not level. Then you've changed the angle of your neck, your cervical spine into an abnormal position, all right? So this is our posture check. We want hips, shoulders, and head against the wall. And this also can turn into an exercise where we do a isometric hold, where we contract muscles to hold this up into this position. So you're going to get yourself set. If you need the towel roll, you're going to put it back there. And then we want to focus on getting the shoulder blades flat against the wall. Can we get the shoulder blades flat against the wall without the ribs popping up or my lower back hyperextending? So I don't want the lower back to hyperextend. I want to bring that mostly flat into a neutral position. There's going to be space here between your lower back and the wall, but I don't want it to be like where you can put like a whole fist in there. All right. You should not be able to fit your fist when we get into this position. Because what happens is oftentimes that when we try and pull this shoulder blade back into a better position, it pulls on the rib cage and it pulls on your thoracic spine. And then we borrow from the lower back and the pelvis, and then we get into this position, all right? So whatever position that you're able to get in, this is basically your check, your assessment. Can I maintain this? So we want to think, all right, shoulders, head, hips, shoulder blades back against the wall, head in neutral, chin is going to be level, and then can I just stand up from there? All right, what does that feel like? Does that feel abnormal to you or very difficult? That's where we kind of tells us like, you know, how or where do we need to improve your posture? Is it something that we have to manipulate the joints in your thoracic spine or your lumbar spine to get the range of motion there? Or is it a strength thing? Do you have weakness in your upper back, your shoulder blades, and your neck to hold you up into this position? All right. Now, let's just say, for example, this is an easy position for you to attain. We've got hips, shoulders, head, feet can be against the wall, away from the wall. And we've got this good position, shoulder blades back and flat, and I got my head in neutral. If you can maintain this, then the next piece is to kind of take your back of your hands and put them on the wall, okay? We see, all right, how easy is this to maintain? Again, you should feel that contraction through your shoulder blades, pulling your shoulder blades back and down as you put the back of your hands to the wall, all right? So you should be activating those muscles that hold you up, trying to maintain some core stability so your lower back doesn't hyperextend, your pelvis doesn't rotate or tilt forward. You want to keep that in neutral, keeping this on, keeping the shoulder blades tight, head neutral. Holding this position for up to a minute is a good postural reset throughout the day, all right? If that is easy, the next step is to take some type of exercise band and add resistance to this movement. So we're going to have a band here. I've got an overhand grip, all right? And then I'm going to assume that same position. My feet do not have to touch the wall. If you have your feet against the wall, that's like bonus points for you to maintain this position. But to make it easy for everybody, I have people just put their feet out in front with their knees bent. So that gives you a little bit of slack below the belt line and into your legs. So we're going to go hips, shoulders, head again. Chin stays in neutral, shoulder blades back and down. And then we're going to put the back of your hands to the wall. But this time we have resistance against that movement with the band. So this turns to be an intense exercise. If we can hold this position using the band resistance, we're really ramping up the intensity of this exercise here to maintain those muscles, to increase their muscular endurance and their activity to hold you up against gravity, okay? So another way or another exercise that we can do is just a banded pull apart. We're just gonna take that same exercise band and work on those muscles that hold us up against gravity. So again, we're gonna be away from the wall, get ourselves in a better position, right? Head over shoulders without looking up, chest is back, chest is out, shoulders are back, and we're gonna take our band and then we're gonna pull that apart, pulling that right out, off to the side, making like a T. The band is touching my chest and my shoulder blades are pinching together. So from the side, we're just doing this motion here. About 10 to 15 repetitions will help you get that feel of activating those shoulder blades and getting you into a position where you can hold your head up in that position. All right, so that's for the shoulder blades. The one thing that I like to do for the neck, and you could do this in any position, is called the chin tuck. So I'm just going to turn this a little bit. So the chin tuck is where we get rid of this thing called the text neck, where your head is forward like this, right? And it's forward of your ears or forward of your shoulders. If we're upright and nice and tall in our shoulders and our trunk, the ears and should be over the shoulders. So the chin tuck is basically taking, like what we did against the wall, we just take your chin, keep it level, and then bring it straight back, all right? And if we go super far back, we almost like give ourselves a double chin, all right? So we got that double chin there. We can hold that for 10 to 15 seconds and then come out, all right? So this is a postural correction for our cervical spine, all right? Working out of that forward and down position like this, getting into a better position, and then reinforcing that and even going past that position. All right, so what this does is kind of maintains the normal physiological range of motion that should be available into your cervical spine, and then feel like, all right, if this is like 100% and that feels super weird, right? I don't want to stay there, but that resets where your neutral is, right? If you're comfortable and you're like, all right, this is where I hang out. This is like my neutral, right? This is not neutral, this is forward. But then if we do this exercise enough, our neutral, our middle turns into a little bit better. So we're more upright and more straight. So that's a good reset. Now, the final thing I want to go over is to try and stretch out. If you've had issues doing this chin tuck and doing this thing on the wall, we want to be able to say, we want to be able to pull those shoulders back. And if we're tight in this pec area, which I find a lot of clients that come in with neck issues and shoulder issues, they're super tight here and their shoulders are rolled forward where if they're standing and they're relaxed, their palm is facing backwards. All right, so if you're standing here, you're like, all right, I'm standing here, and your palm is facing backwards, that means that all of this tissue in your arm and your shoulder blade is tight in the front. Ideally, we'd like to be able to stand with our thumb pointing neutral. This is our neutral position, and this should feel comfortable versus standing like this. All right, standing like this is like a sure sign that we've got tight shoulders. All right, now to stretch that out, I'm just going to turn this to here, and I'm going to open my door, and then we're going to use the door for a stretch. All right, here we go. So we're going to put the hands out like this, and then get ourselves through the doorway, elbows at shoulder height, and we want to focus on getting the ribs to stay down. We don't want to, again, hyperextend our back like we had against the wall. We want to keep our spine neutral as we bring our chest forward. All right, so that should give you a good stretch into the chest, the pecs, and shoulders. We want to hold that for 30 seconds. All right, 30-second hold with a good posture with our spine.